Welcome to online session for Nutrition 1, Breastfeeding. I am Dr. Maria Cristina Gorospe Moralion, the Chair of Breastfeeding Committee of De La Salle University. Good day from my two breastfed babies. The objectives of this session is to apply the 10 steps of successful breastfeeding in different clinical scenarios pertaining to infant nutrition and apply the principles of breastfeeding to ensure good infant nutrition. About 5,500 children die every day because of poor infant feeding practices, including impaired development, malnutrition, and increased infectious and chronic illness. Rising rate of obesity in children are also limited with lack of breastfeeding. Improved infant and young child feeding is relevant in all parts of the world. The aim of global strategy is to improve through optimal feeding the nutritional state, growth and development, health, and thus the survival of infant and young children. It supports exclusive breastfeeding for 6 months, followed by timely, adequate, safe, and appropriate complementary feeding, while continuing breastfeeding for 2 years and beyond. It also supports maternal nutrition and social and community support. What are the 10 steps to successful breastfeeding? Number 1, have a written breastfeeding policy that is routinely communicated to all healthcare staff. Train all healthcare staff in skills necessary to implement the policy. Inform all pregnant women about the benefits of breastfeeding. Help mothers initiate breastfeeding within half hour of birth. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Give newborn infants no food or drink other than breast milk unless medically indicated. Practice rooming in, allow mothers and infant remain together 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. Step 1. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. The MBFHI team of the LSU have come up with its own written policy approved by the DOH last February 2018. The policy requires a course of action and provides guidance. What should be covered by the breastfeeding policy? It should include the 10 steps of successful breastfeeding and the institutional ban on acceptance of free or low-cost supplies of breast milk substitutes. How should it be presented? It should be written in the most common languages understood by patients and staff and should be posted in areas where mothers and babies are cared for. Second step, train all healthcare staff in skills necessary to implement this policy. The MBFHI team conducts a regular updates on breastfeeding and holds a 20-hour lactation seminar every 3 years. The following knowledge should be emphasized. Breastfeeding Mother-Baby Friendly Hospital should promote, protect, and support breastfeeding and rooming-in practices, empower the mother to successfully breastfeed, upholds the right of infants for breast milk, and do not accept free supply of infant formula. A mother-baby friendly hospital should also be a hospital that should not maintain a nursery for newborn normal cases, follow the principle of breast milk first and foremost, follows the principle of absolutely no milk formula for the newborn, and followed the WHO UNICEF 10 steps to successful breastfeeding. Additional topics for training in the context of HIV should be included in the areas of knowledge. All staff should also be trained in the basic facts on HIV and prevention of mother-to-child transmission, voluntary testing and counseling for HIV, locally appropriate replacement feeding options should be presented, and how to counsel HIV plus women on risk and benefits of various feeding options and how to make informed choices. Additional topics should also be included on how to teach mothers to prepare and give feeds, how to maintain privacy and confidentiality, and how to minimize the spillover effect, leading mothers who are HIV or of unknown status to choose replacement feeding when breastfeeding has less risk. Step 3. Inform all pregnant women about the benefits of breastfeeding. In many cultures, women assume that they will breastfeed. In other cultures, where breast milk substitutes, like in our country, are widely advertised and promoted, most women decide whether or not to breastfeed before their baby is born. It is important for us to educate women about breastfeeding as early as possible and to identify mothers and babies who may be at risk of breastfeeding difficulties. Why is breastfeeding important? Breastfeeding is important to children, to mothers, and to families. Breastfeeding protects infants' health. Children who are not breastfed are more likely to be ill or die from infectious cases and infections such as diarrhea and gastrointestinal infections and chest infections. They may be underweight and not grow well, or overweight and to have later heart problems if they live in rich circumstances. Breastfeeding is important to mothers. Women who do not breastfeed are most likely to develop anemia, obesity, become pregnant soon, develop breast cancer, and have hip fractures in older children. In addition, breast milk is readily available. Mother's milk is all a baby needs, and mother's milk is unique because human milk is a living fluid that actively protects against infection. Artificial formula provides no protection from infections. Exclusive breastfeeding is recommended for HIV-infected mothers for the first 6 months of life, unless replacement feeding is acceptable, feasible, affordable, sustainable, and safe for them, or what we call the AFAS. And their infants before that time, when replacement feeding is not available, avoiding of all breastfeeding by HIV-infected mothers is recommended. The importance of breast milk and breastfeeding. The action of breastfeeding helps a child's jaw to develop, reduce ear infection, assist with clear speech, protects from dental caries. It can regulate appetite and thus prevent obesity, and can provide warmth, closeness, and contact which can help physical and emotional development of the child. Mothers who breastfeed are less likely abandon or abuse their babies. Breast milk is important for children since it provides ideal nutrition to meet the infant's needs for growth and development. It can protect against many infections and can reduce risk of allergies and non-communicable chronic diseases such as obesity and hypertension. Non-breastfed children are more likely to develop infections, eczema or atopic conditions, neck or necrotizing enterocolitis in preterm infants. They have lower educational achievement, juvenile onset IDDM, and even cause neonatal deaths. How is breast milk unique? Breast milk has over 200 known constituents as well as constituents that are not yet identified. Each animal has milk specific to the needs of that species. A mother's milk is especially suited for her own baby. It changes to provide nutrition suitable for the baby's needs. Colostrum and breast milk are adapted to gestational age, and mature breast milk changes from feed to feed, day to day, and month to month to meet the baby's needs. Breast milk is a living fluid that actively protects against infection. A child's immune system is not fully developed at birth and takes to age 3 or more to fully develop. Breast milk provides protection for the baby in a number of ways. When the mother is exposed to an infection, her body produces antibodies to that infection. These antibodies are passed to the baby through her breast milk. Mother's milk stimulates the baby's own immune system. Factors in breast milk help the growth of the cell walls of the baby's gut, thus aiding the development of a barrier to microorganisms and allergens. White cells present in breast milk are able to destroy bacteria. Components in breast milk also prevent the microorganism from attaching to the cell wall. If they do not attach, they pass out of the baby's system. The growth of beneficial bacteria in the breastfed baby system, including Lactobacillus bifidus, leaves little room for the growth of harmful bacteria. And nutrients are not available for harmful bacteria to grow. For example, lactoferrin binds to iron, preventing disease-causing bacteria from using this iron to multiply. What are the types and composition of human breast milk? First is your colostrum, or your early or first milk. Colostrum is produced in the breast by the 7th month of pregnancy and continues through the first few days after birth. In appearance, colostrum is sticky and clear to yellowish in color. It acts like a paint coating the baby's gut to protect it. If any water or artificial feeds are given, some of this paint can be removed, allowing infections to get into the baby's system. Colostrum is a baby's first immunization against many bacteria and viruses and helps establish a good bacteria in the baby's gut. Colostrum is the perfect first food for babies with more protein and vitamin A than mature breast milk. It acts as a laxative and helps the baby to pass meconium. This also helps prevent jaundice. Colostrum is very small amount, and this suits the baby's very small stomach and the immature kidney that cannot handle large volume of fluid. The other one is your mature milk. Mature breast milk contains all the major nutrients, the protein, carbohydrates, fat, vitamins, minerals, and water in the amounts the baby needs. It changes in relation to the time of day, the length of a breastfeed, and needs of a baby. The components of breast milk provides nutrients as well as substances that help in digestion, growth, development, and provide protection from infections. Breast milk continues to provide these nutrients, protection, and other benefits as a child grows. These components do not disappear at a certain age. What are the nutrients in your breast milk? It contains protein, fat, carbohydrate, iron, water, and flavor. The flavor of breast milk is affected by what the mother eats. The variation in flavor can help the baby get used to the taste of family food and ease in transition of this food at after 6 months of age. Step 4. Help mothers initiate breastfeeding within half hour after birth. Skin-to-skin contact. Ensure uninterrupted, unhurried skin-to-skin contact between every mother and unwrapped healthy baby. Should be started immediately, even before cord clamping, or as soon as possible in the first few minutes after birth. We should arrange that this skin-to-skin contact continue for at least 1 hour after birth. A longer period of skin-to-skin contact is recommended if the baby has not suckled by 1 hour after birth. What are the benefits of a skin-to-skin contact? It calms the mother and the baby. It keeps the baby warm with heat from the mother's body. It assists with metabolic adaptation and blood glucose stabilization in the baby. It enables colonization of the baby's gut with the mother's normal body bacterial gut, provided that she is the first person to hold the baby and not a nurse, doctor, or others. It reduces infant crying, thus reducing stress and energy use. It facilitates bonding between the mother and her baby as the baby is alert in the first 1 to 2 hours. After 2 to 3 hours, it is common for babies to sleep for long periods of time, and it allows the baby to find the breast and self-attach, which is more likely to result in effective suckling than when the baby is separated from his or her mother in the first few hours. New interpretation of Step 4 in the revised BFHI Global Criteria states that placing the babies in skin-to-skin contact with their mothers immediately following birth for at least an hour and encourage mothers to recognize when their babies are ready to breastfeed, offering help if needed. When the baby is on the mother's chest with skin-to-skin contact, the breast odor will encourage the baby to move toward the nipple. It will help the mother to recognize the pre-feeding behaviors or cues, which includes a short rest in an alert state, bringing his or her hand to her mouth, make suckling motions, sounds, and touching the nipple with the hand, focusing on the dark area of the breast, rooting, finding the nipple area, attaching with a wide open mouth. These are the pictures of feeding cues. Initiation of breastfeeding. Encourage the mother to breastfeed when the baby shows that he or she is ready, usually within an hour after birth. It is unnecessary to hurry and force babies to the breast. A mother and her baby should be quietly kept in skin-to-skin contact until they are both ready to breastfeed. This may be a few minutes in an hour or more. Early touch of the nipple and areola results in a release of the hormone oxytocin. Oxytocin helps the uterus to contract more quickly, which may control bleeding. Routine use of synthetic oxytocin and ergonomethrin are not necessary when a mother is breastfeeding after birth. The mother, to feel more loving and attached to her baby, should be encouraged. Colostrum, the first milk in the breast, is vitally important to the baby. It provides many immune factors that protect the baby, as discussed previously. Prelacteal feeds are oily fluid or feed given before breastfeeding starts. They might include water, formula, traditional feeds such as honey, dates or banana, herbal drinks, and other substances. Even a few spoonfuls of these fluids or feeds can increase the risk of infection and allergy to the infant. If prelacteal feeds are used in the area during pregnancy, discuss with the mother the importance of exclusive breastfeeding and how she might achieve this. Step 5. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. These are the signs of good attachment. The nipple and areola are stretched out to form a long teeth in the baby's mouth. The large ducts that lie beneath the areola are inside the baby's mouth. The baby's tongue reaches forward over the lower gum so that it can press the milk out of the breast. This is called suckling. When a baby takes the breast into his or her mouth in this way, the baby is well attached and can easily get the milk. However, the following are the signs of poor attachment. The nipple and areola are not stretched out. The milk ducts are not inside the baby's mouth. The baby's tongue is back inside the mouth and cannot press out the milk. The baby is poorly attached. He or she is suckling only on the nipple, which can be painful to the mother. The baby cannot suckle effectively or get the milk easily. The following are the signs that the baby is suckling effectively. Slow, deep sucks, visible or audible swallowing, fullness of cheeks, baby finishes the feed and releases the breast by himself or herself. You should observe the following cues for effective baby suckling. And the baby is not suckling effectively if a baby shows rapid sucks, smacking or clicking sounds, cheeks drawn in, fauces or appear unsettled at the breast, feeds very frequently, feeds for a very long time, not contented at the end of every feed. Here are the mechanics of breastfeeding. The mother should be comfortable and support the baby's neck and shoulder with her arms on her pillow. Move nipple gently back and forth across the baby's mouth. Make sure the baby's chin, not the nose, is in contact with the mother's breast. The mother may need to hold or support her breast while nursing. The baby's mouth will usually detach automatically when baby is finished. If the mother or baby are not comfortable or relaxed, it's okay to start over. You should reassure the mother that it's okay to ask for help. There are several types of breastfeeding position. First is your side lying or lying down on side position. It helps the mother to rest comfortable after a cesarean section. It takes care of the baby's nose on a level with mother's nipple, and the baby does not need to bend his or her neck to reach the breast. In cradle position, the baby's lower arm is tucked around the mother's side, not between the baby's chest and the mother. Should take care that the baby's head is not too far into the crook of the mother's arm that the breast is pulled to one side, making it difficult to stay attached. The cross arm or football position is useful for small or ill baby. Mother has good control of baby's head and body, so may be useful when learning to breastfeed. If the mother developed by a twin gestation, an underarm position may be useful for twins in order to help drain all areas of the breast. Here are the signs that the baby is getting adequate for every feeding. The baby feeds frequently, stays 10 to 15 minutes on each breast per feeding, has adequate wet diapers, adequate stools, and the baby is gaining weight.